I cheat around my GTT? Like, are you sure, doctor? I have to take that sugary juice. It was too sweet. This is what some of my patients who turned out to be gestational diabetes told me. They were in denial. They thought they were not fasting enough, or the doctor actually told them to eat more sugar before coming to the test. And for sure, doctor, that juice was like, oh my god, so sweet. It's because of that I have diabetes. So many of my patients have told me that. And I have had the test. I know it's like really sweet. That juice has 75 grams of glucose load. When I used to have a lot of Maggie, okay, before pregnancy. And I checked the glucose load of Maggie, one pouch of it, like the smaller Maggie, it was 50 gram carbs in that. So just imagine how my body was pretty okay with having Maggie, because it's amazing and tasty, 50 gram, but not okay with the 75 gram glucose load. Now, why do you think is the doctor or the healthcare everywhere is giving you this juice? We give this juice and do the same test for everybody. And there are so many patients whose tests come normal. And if you are someone whose test has come positive, it's because you have that insulin resistance and you have that tendency to have gestational diabetes and diabetes in future. So, your pregnancy, when you did this GTT, you gave the fasting sample, you drank the juice in one go, you did the 1 hour test, 2 hour test, and it's coming problem. That means you have diabetes in pregnancy. And it's time that you take care of it. Alright? Now, if you want to try doing the test one more time, you can do it, but I wouldn't recommend it. I mean, if you're trying to do it again, that means you think that you don't have diabetes. And we need to talk about that. Why do you think that it's worth doing the test one more time and not accepting that you have diabetes? That's number one. Second of all, some patients genuinely will come and tell me, listen doctor, I don't think I was fasting enough. And I really think I don't have diabetes. And I don't have family history of diabetes. Look at me, I'm so skinny. I wouldn't say no. And some of them, even if they were not skinny, they genuinely come and tell me that, doctor, I was not fasting and I would like to give it a shot again. And generally in our hospital setting, we are very strict around diabetes in pregnancy. But I always tell my patients, you know what, you want to get pricked 3 more times, go ahead, do it. I will schedule a GTT for you. Some of them do it and most of them won't do it. They would rather just check themselves. Now, I had diabetes in pregnancy. And the funny thing is about me, my GTT was normal. But I had insulin resistance before I got pregnant and I was already on metformin. So my doctor told me, you know what, Rashmi, just check your sugars around the clock. We tell our patients to check sugars, just check your sugars around the clock. Like, we don't realize that we are telling our patients to prick again and again. And just because I used to tell my patients, I thought, let me try checking my sugars all the time. And I checked and I got to know my body, how it is responding to foods. And I was surprised how a normal rice doesn't produce any problem. But if I have pasta and sugars and all of that, my sugar would go 200. So do the diabetes. Like, if you have diabetes, God has given you an opportunity to correct it. So don't cheat around it. These tests are for your well-being. Like, really, there's nothing in life. Like, if you're going to live another 50 years, would you like to live your 50 years healthy in the best form of you? Or would you like to be sick with diabetes, high blood pressure, can't fit into your clothes, miserable? Like, pregnancy gives you an opportunity to correct it. Take that opportunity. Only you can do this for yourself. Your husband won't, your mom won't, your kids won't, nobody. Only you. And I will help you do that. If you follow my program and you do exactly what I tell you to do, you're going to take full control of your life. And best of luck. That's what I want for you.